Good evening, I'm Amy Robinson and welcome to Ask the Specialists. Tonight we ask the veterinarians on CMU Public Television. Welcome back. Pet lovers, pull your chairs a little closer. Tonight we're going to ask the veterinarians on CMU Public Television. Your calls fuel this program, so please call with the questions that you might have. And first, let's welcome our guest this evening, Dr. Alex Imlay from Animal Health Associates in Mount Pleasant. Welcome.
Thanks, Amy. I'm glad to be here.
And tell me a little bit about the patients you treat, large and small animal, I understand.
Yeah, all of God's creatures, we attempt to take care of them and provide them with preventative medicine. Horses, cattle, pigs, cats, dogs, pocket pets. We have the pleasure of treating a lot of different animals.
Very good. Well, welcome and thanks for coming. Also this evening, Dr. Laura Weber with State Road Animal Hospital in Elma. Dr. Weber, welcome.
Thank you for having me. We actually treat mostly companion animals, cats and dogs, some pocket pets and small mammals.
Okay, very good. Well, we'll be taking your calls tonight on Ask the Veterinarians, and let's get started with some questions we had called in ahead of time. What is the best way to keep a dog's teeth clean? This question coming on Facebook for us. Dr. Weber, what would you recommend?
Well, there's a number of things that you can do at home preventatively, just like how we brush our teeth twice a day to keep them clean. They do make toothpaste specific for dogs and cats. They make special brushes and finger brushes you can use. I find sometimes even just putting a little piece of gauze on your finger with the toothpaste gives you a little more control. There are some water additives that help to wash the bacteria off of their teeth. And to a certain extent, there's some special treats and things that are designed to help kind of break down tartar.
How well do those treats work?
The treats can work if you have an animal who chews a lot. Some animals naturally swallow their food whole. Also, they can be high in calories sometimes, so you have to be careful how many of those treats you give.
Okay, thank you. And Dr. Imlay, now, not everyone was raised in the tradition of brushing their pet's teeth. Why is this important to do?
Well, years ago, pets, dogs, cats were kind of thought of, conveniences, right? Now they're members of the family. So as a member of the family, we'd like their breath to smell sweet when they get up in our face. So we want them to live a long, happy life. And we know that dental decay results in shortening of their life. They can absorb bacteria through the gums, cause heart disease and other things. So it's really important for keeping our pets healthy and safe that we keep their teeth clean.
All right, very good, thank you. Let's get right to our callers, and thank you for the calls coming in for Ask the Veterinarians on CMU Public Television. We have a person from Leroy, Michigan, calling in with the Chesapeake Bay Retriever. Lumps growing on the dog, started pea-sized and now they're golf ball sized. Could this be caused by the food? Or a follow-up question, Dr. Weber, how would we begin to assess what these lumps may be?
Well, lumps or subcutaneous masses can occur in dogs for a number of reasons. Some dogs will develop what's commonly known as fatty tumors or lipomas as they age, especially some of the retrievers. Those are usually non-cancerous, and we don't know that they are necessarily related to food, but they can be related to obesity. Anytime your dog has a mass under the skin or a new lump, it really should be looked at by your veterinarian. There are some simple tests we can run to determine if it's something to be worried about or that needs to come off.
So is there something then, Dr. Imlay, that the pet owner can look at to at least start to get an idea, or that they should report to the vet? Is it a soft lump or is it a hard lump, or does it move, or is it more stationary?
Yeah, I guess what we usually recommend, if it appears quickly and grows fast, or if there's some discoloration of the skin, or if it's tender or painful, those are all indications that it probably should have what we call a fine needle aspirate performed by your veterinarian. Look at the cells and try to assess whether it could be cancer. So that's what I'd recommend.
Okay, very good. And Dr. Weber was talking about how some of these fatty lumps can be associated with age. So let's talk about our aging dogs. Give us a little bit of a broad topic, but what are some suggestions on how to keep our aging friends in the best health?
Well, I guess to start with, we kind of the ballpark age is 7. When they're over 7, we recommend getting a geriatric profile. We'll invite them in, we'll do a thorough exam, check their hips, draw some blood. try to make sure that their kidneys, liver, heart, all their organs are working effectively. And if there's problems, we can make adjustments in diet, exercise. There's some natural vitamins which can help cleanse the liver. There's a lot of different things we can do to help prolong their life and have a high quality life.
All right, thank you. And Dr. Weber, let's not just talk about man's best friend, but also cats, who are also our best friends. Is there any difference? What do we need to know about aging cats?
Well, there are a number of things that are different about cats than dogs. Specifically, a lot of people don't realize that cats actually do get arthritis, just like dogs do. They're less likely to limp or be slow to get up. The most common sign of pain in cats is actually just reluctance to move around, which can be hard to assess in a rather sedentary animal anyways. But they can have osteoarthritis. Also, watch carefully always for any changes in their drinking habits. If they're urinating more often than normal or vomiting regular, those are some of the precursors to a lot of the disease that we see in kitties and can be a sort of a red flag that they need to be seen.
All right, very good, thank you. From Detour in the UP, we have a question. Is it safe to give dogs raw bones, chicken or beef? Dr. Imlay?
It is probably not a good idea for a couple of reasons. Number one, they certainly can have bacteria. Well, they probably do have bacteria, and the bacteria can be absorbed and cause an infection, can cause diarrhea, can cause worse types of infections. The other things that can happen is that, especially with chicken bones, they can chart and make sharp points on the bones when they chew them. So they swallow the sharp points. It isn't passed well, and it can cause a laceration or an opening in their bowels and cause infection and death. So I wouldn't feed my dogs raw bones, irregardless whether it's chicken or cow or venison. It's not a good idea.
Okay, very good. And so let's talk about what we can feed them. I remember when I got a puppy years ago, and it was recommended to give them a certain type of food because there was less filler in it. And so they'd digest more, they'd get more nutritional benefit, and have less waste in the yard, which was a nice, nice benefit. So to follow up on that, we have a call from Hemlock saying, what are some good dog foods that you recommend?
Well, one of the things we always recommend with people is that they look at what's called the AFCO statement on the back of the dog food. The AFCO statement is going to say whether the food was formulated for a pet or whether it's actually been tested for that particular animal. We prefer foods that have actually undergone some level of testing to prove that that food is adequate nutrition and that animals do well when eating it. So anything that's been formulated for a food has gone to market before it's ever actually been fed to an animal in some cases. So.
Okay, very good, thank you. And we have a question coming in from Twitter. Dr. Imlay, let me ask you, how do you help pets who have been together for 10 years cope when one of them passes away?
Well, I think it's very, very difficult. I think you personally spending lots of time with your pets, maybe having a blanket that the other pet enjoyed or bedding, things like that to try, but it's just going to take time, and spending as much time as possible with your pet doing the things that they'd like to do, go for walks, runs, swims. If it's a dog, if it's a cat, playing off the string on a feather, things like that, and they will get over it with time, but it will take weeks.
And so have you observed grief in pets?
Yeah, they grieve. All animals grieve. It's amazing. Horses, I've seen 2 horses that have been buddies in the pen for 10, 15 years. They really are upset when one passes on, and it does take time.
All right, very good. From Lakeview, we have a question about an older cat, a 14-year-old cat having seizures every few days. And the question, Dr. Weber, is what could be causing this?
Well, aging cats can develop seizures for a number of reasons. Definitely having seizures every couple of days in a kitty should be addressed by a veterinarian sooner rather than later. Kidney disease can cause seizures. Sometimes those kidney enzymes elevating can start to cause those problems. Certainly different types of cancer. Seizures aren't as common in kitties as they are in dogs. So when we see them, we really need to get to the underlying root of the problem as quickly as possible.
Okay, so it's a see your vet situation.
See your vet.
All right, very good. We have a question from Boyne City, an individual who has a German Shepherd and problems with hips and back legs, and wondering what they can do to prevent this. Dr. Imlay?
Well, number one, they should go see their veterinarian and probably have some diagnostics done, radiographs and blood work to try to tell if there is some early osteoarthritis. German Shepherds actually can get a degenerative nerve and muscle condition in the back legs. So you need to rule one of those in or out. There's natural medicines that can be given, glucosamines work well. Then there's what we call NSAIDs that can help if it's osteoarthritis. If it's a degenerative disease of the muscles or nerves, there's probably not a lot you can do to prevent the progression of that. It's just very sad.
All right, thank you. And thank you for your calls. Keep them coming in around Ask the Veterinarians on CMU Public Television. You can also reach us on Facebook and Twitter, and we have another question coming in from Twitter. What does it mean when a dog has reddish arms and is chewing on them?
Well, most commonly we'll see that when we've got an underlying allergy or an allergic reaction happening. The top three reasons, or the top three types of allergies we see in dogs are food, flea, and environmental. So they can become allergic to things like dust mites, proteins in their foods, any kind of ectoparasite in the environment. So it is something that should be addressed with your veterinarian, because they could come up with some medications to make your dog much more comfortable. Sometimes it's even as simple as an antihistamine that should be evaluated.
All right, and we have a lot of questions to get to. We're getting to them as quickly as we can, but I want to take just a moment, because before the show we were talking, and Dr. Emily, you felt this was important to touch on, and that has to do with toxicities. We're coming into spring, we're coming into Easter, we're going to have Easter lilies, we're going to have chocolate, and you're saying that you still hear from pet owners who really aren't aware of the things that can hurt their pets.
I think it's really important that people understand that the lily is extremely toxic, especially the cats. Even chewing a little teeny bit on a dried leaf can cause them to have renal failure and die. I have seen it happen where a beautiful bouquet of flowers comes for the Easter time, and not knowing, the owners didn't know that the pets chewed on them, and they actually have died. So it's important to look at your flowers, know what they are, talk to the people you're buying your flowers from before. If they have pets, they probably should not get any type of lilies.
All right, very good. Thanks for the tip. From Lakeview, we have a question. What is the best way to prevent fleas on cats and dogs, and what can you do when they're gone to keep them that way?
Fleas have become a real problem in Michigan because the winters aren't quite as cold as they used to be, and definitely not as consistently cold. So the best thing to do is to use a prescription flea medication every 30 days year-round. We're starting to recommend flea medicine all year round, just like we recommend heartworm all year round now, because of the changes in climate. Once they're gone, really the only way to prevent them is to keep at it. Every single pet in the house has to have a flea preventative on, even the ones that stay inside.
And so let's follow up on that, because in addition to the fleas, you're talking heartworm, and you're saying that this is a problem that maybe you're seeing more of.
We are seeing more and more heartworm disease in our area, and really nationwide. Part of that is because the mosquitoes that carry heartworm disease are able to hatch in fairly mild weather. We don't need warm summer temperatures in order for those mosquitoes to hatch. So we have actually diagnosed a number of heartworm positive dogs even in just this last month of February.
All righty. We have a question called in. Animal's nose is losing its pigment. Why does that happen?
A lot depends on the breed. It can be related to allergies, and if there's some pruritus or itching, they'll rub their nose and that can start it. Really, it should be seen by a veterinarian, because there are some other causes that you might need to take a fine needle aspirate and rule those out. Cancer can be a cause as well.
All right, and let me follow up with another question coming in from Twitter. Thanks for keeping them coming in for us. My dogs are both fixed but are showing mating habits. Why could this be occurring?
Well, some dogs will do mating habits as kind of like a dominance behavior or a play behavior. It's not always necessarily with a sexual intention. So you may have more of a behavior issue, and you may want to talk to your veterinarian or a local dog behaviorist about what you're seeing, because sometimes those behaviors can progress into aggression depending on if it's playful or not.
All right, well, let's stick with behavior for a minute. We have a call coming in from Beulah, a 5-year-old Chihuahua that licks the floors and pants. And how do we stop this behavior?
Well, I guess maybe Dr. Weber can help on this one. I really don't have a good answer for the licking of the floor, other than keeping them busy. It's actually something that happens, and I don't think anybody really knows why, whether they get gratification from it. I guess
So that's not unusual?
Not unusual, no. What I would suggest is trying to get them excited about something else, okay? So if they lick the floor after they get out of their kennel, play catch with them. Do something else and reward them for the proper behavior. We've discovered that you almost reinforce the negative behavior by drawing too much attention to it. So, try to change things, make it fun to do something else, and then hopefully they'll minimize or limit that amount of bad behavior. But I don't know of any real reason or any steady way to do that as far as changing them.
And have you noticed anything where this is breed or size specific? Is this more common with small dogs? Is it across the board?
I haven't really noticed any difference with breed or size. Like Dr. Emily said, it could just be a behavior problem. It could be a boredom problem. There are toys now that are designed to give dogs something interactive to do. They press a certain thing or chew on a certain part and a treat comes out. As far as the panting excessively goes, that could be like a metabolic problem in some dogs or an underlying lung issue. So if the panting is separate from the licking of the floor, then that may need to be addressed.
All right, thank you. We have a question, follow up on our flea discussion. If the animal now is out of the house permanently, how do we get the fleas out of the house?
Well, probably the best way is to call a professional exterminator to have them come in, because what happens everywhere the pet walks, the flea eggs, it's like salt and pepper, just sprinkles off their body. So if they go underneath the couch, underneath the bed, on top of the bookset, there's going to be flea eggs there, and then they hatch, into a larva and pupae, and that's how the cycle continues. So you need somebody, you could probably do it yourself, but it's going to take a lot of work. You're going to have to clean all surfaces, under everything, to get rid of all the eggs, and that's how you're going to break the cycle. But probably it's best to call a professional because they guarantee their work, and if the fleas come back, they'll come in and fix it for you.
All right, very good. And I see another question coming in through Twitter. We have an active account this evening. Do cats grow bigger in size once they're fixed compared to unfixed cats?
Well, certainly getting fixed does tend to slow the metabolism a little bit. So often people will complain that they think their cat has gained weight as a result of being fixed. In a little bit they can. I find more commonly cats gain weight because they're not actually active enough for the amount their owners are feeding them. So we want to be careful not to overfeed a kitty who spends 16 hours a day sleeping, because caloric requirements probably aren't that high.
Sounds like a lovely lifestyle,
I would
but
love
then
to
you
be
have
a
to
cat.
adjust your meals.
Well, I think we make the mistake. We kind of look at kitties as just being there. I think we as pet owners, kitty owners, we need to be interactive. We have a little kitty that she just loves to play, and she doesn't let you just sit around. You need to do things with her. And I think as a good cat friend, we need to do those things with our cats. I think we'd have less problems with obesity if we participated with them in play every day.
Now, have you had owners that their cats will go for walks with them?
I have, yeah. Cats can be trained to do anything dogs can do. It just takes a little bit more time and more persistence. If a cat is very food motivated or treat motivated, you can teach them to do all kinds of tricks.
So let's follow up with the cats a little more. From Honor, Michigan, we have a cat with kidney problems, a 15 or 16-year-old cat. Will a raw diet be helpful? The cat doesn't like canned food and vomits.
Well, it seems to be a common issue in some of our older cats, and 16 is an older cat. Definitely need to go see your veterinarian, do some blood work, try to determine what the blood urea, nitrogen, creatinine, and phosphorus are, and then there are some protocols we can put them on to help slow the progression of the disease. Probably the raw diet is not going to help in this stage. There's no cure. That's the sad thing. We can slow the progression. We worry about quality of life. We try to minimize their vomiting. We can supplement them with fluids, sub-Q fluids, IV fluids at times. But again, we're just slowing the progress of the disease. We're not stopping it.
All right, thank you. We have a question from Gaines, a person who's adopted a terrier that was in a fire and got burned on the back. Will the fur come back?
It can be hard to know. It depends on the extent of the burn and how deep it went. Many burns scar permanently. There are some modalities. We now have therapy lasers and things that we can use in companion animals that sometimes will help stimulate blood flow to those scarred areas and may increase the likelihood that the fur will grow back. If the dog's still painful in that burned area, then the laser treatments would really help with any pain that's associated with the burn.
Alrighty. From Mount Pleasant, we hear from another cat owner. This person has an indoor cat and says, what vaccines are you requiring or recommending? And do you recommend the same vaccines as you would for an outdoor kitty?
Well, I guess I would say, well, no, absolutely we don't. I guess we recommend rabies for everybody, just whether they're indoors or outdoors, just in case we have a bite. And then we recommend basically a three-way, a feline, upper respiratory calicivirus, rhinotracheitis, as our basic one. I don't recommend feline leukemia for indoor cats because they're not exposed to other cats. And the only way they're going to get feline leukemia if they're exposed through bodily fluids, saliva, blood, etc. So if they're isolated inside, I don't think they need feline leukemia.
And what about heartworm for cats and for indoor cats?
Well,
we recommend heartworm testing for all kitties because it's not treatable in kitty cats because the worms are so much larger for the small animal size. And because mosquitoes can come in the house, I recommend heartworm preventative for any pets that you have.
All right. When is the best time to neuter a dog? I used to hear conventional wisdom, you wait till they're 6 months old. This question coming from Grayling and also asking then what are the benefits?
well, I think what we have, there are some humane societies that neuter pets at a very young age. I think for their safety, it's wiser to wait till all their organs are developed. And I think that's around, sometime after 5 months, 5, 6, 7, 8 months. So that's probably the safest time to do the neutering, castration, spaying, because then they can handle your anesthetic, hopefully an inhalant to the best of their ability, and you have less complications. I think the big thing about neutering a pet is that it becomes your family, okay? It bonds with you. It doesn't have the instinct to make it go pursue a mating, down the road. Because we see so many tragic things where animals are hit by cars. I think you want to be your friend, your pet, your family member, and bond with you, not have that natural instinct of running.
Sure, sure. All right. What is the recipe for getting rid of a skunk smell on a dog?
Well, I wish there was a magic solution. I've seen a number of them. Honestly, the only way to get rid of it completely is to shave the dog bald, but most people will use a mixture of peroxide and baking soda and tomato sauce, something like that. There's a number of them online. Although for a while, every time your dog gets damp or wet, they're going to smell a little skunky for usually a month or so after the spray.
All right. And we have another Twitter question, and let me mention before we go to it, I have a lot of questions here that we're not going to have time to get to, but after the program, we will have some additional questions answered on our Facebook page, and that is at facebook.com/askthespecialist. So you may want to check that out. So coming in from Twitter now, why does my golden retriever have runny eyes?
Well, I guess to start with it, we need to inquire as the age of the golden retriever, okay? If it's a young dog, it can have congenital problems called entropion, where the eyelids can roll in, and actually the eyelashes will touch the surface of the eye. That will cause a chronic tearing. So you'd want to look at that first. If it's an older dog, it could be allergies. There's a lot of different causes. There can be pathologies to the eye. So they should definitely see a veterinarian, which would do an ophthalmologic exam and try to determine what's going on there.
Alrighty. A call from Flint, Michigan, someone with an interesting Yorkie, wondering how to potty train the dog when he won't go to the bathroom outside, he eats his feces, and is also very aggressive.
Wow, that is
Sounds like a handful for a small dog.
It does. Well, first of all, I would recommend maybe having the dog evaluated by your veterinarian to see if there's reasons for aggression. I've had a number of small breed dogs with chronic ear infections that the owners didn't even know were there that were causing the dog to become aggressive towards the owner. Potty training in general it takes a lot of commitment, especially in a dog. The longer they go without training, the longer you're going to have to work at it. It's important that you go outside with the dog if they're food motivated or toy motivated, so when they do go potty that you're there to reward them right away. And also many places find that crate training helps a lot as well. You want a tiny crate for a tiny dog so they can't go potty in one corner and then go lay down in another. But I think that would be a good pet to go check up with the vet because there's a lot going on there.
Mm-hmm. Why does a dog eat grass? This question coming in from Saginaw, Michigan.
Well, I wish we knew, but I think they just enjoy it. I don't think there's any pathology. There's no danger to eating grass, and they'll do it intermittently. Some weeks they'll do more than other weeks. I think they like some grasses better than others, but it is not evidence of a disease. They just enjoy eating grass.
All right. From Taylor, we're hearing from a person who adopted a 7-year-old cat which drools excessively when it's being petted. Mm-hmm. Why would this happen?
You know, that's not actually all that uncommon. Some cats do drool when they feel euphoric or happy. Some cats also will nurse when they feel euphoric. It seems that some of them have almost a delayed sort of kittenhood that can allow these things to happen. Now, if drooling happens any other time, like when the cat's not being petted or loved on, then we might want to have a veterinarian take a look, make sure the teeth are all looking good, that we don't have any dental disease or anything going on in the mouth that could be causing problems. But we see about 1 in 10 cats will drool when they're really, really happy. So.
Alrighty, I'm going to kind of combine a couple of questions here because I saw one earlier in the stack about an individual who was feeding their dog vegetables and food from the table, but I think they felt it was kind of wholesome food, healthy food. We just have a couple of minutes left, but now we have one saying, is it okay to give meat at the dinner table? So basically, how does people food stack up with dog food?
Well, you know, I think the bottom line is we do have quality human foods as well. I guess you have to think about what you would like your dog to be doing while you're eating. Okay, if you feed your dog food from the table, they're going to be around you begging, which may not be such a great thing if you have guests over. Every bite of dog food is balanced for vitamins, minerals, protein, carbohydrates, and fats. And it's processed, good dog food is processed in a way that they can maximize the absorption of those nutrients. So it's probably by far and away better to feed a processed, high-quality dog food than people food. But you certainly can give them high-quality people food as well and meet their needs. It's just a lot harder.
And we only have 1 minute left, but with the mix of questions we have here, I have to ask you as a vet, how often are the questions that you're dealing with purely medically related, and how often is it kind of a behavioral thing?
Well, I'd say there's a little bit of behavior in almost every veterinary appointment. So because they aren't able to talk to us, so how they behave is so crucial to how we try to figure out what's going on. It's how veterinarians put all the pieces of the puzzle together. So at our practice, we actually have a behaviorist on site, which is great for me because I can go to her if I'm not sure of the answer.
All right. Well, thank you so much for joining us tonight. Thank you for your questions. We've been talking with Dr. Alex Imlay with Animal Health Associates in Mount Pleasant and Dr. Laura Weber with the State Road Animal Hospital in Alma. Thank you to you for your calls. Thanks to our phone operators. And again, a reminder to check out our Facebook page for questions we weren't able to get to tonight. That is facebook.com/askthespecialist. Answers to your questions will be there. And we invite you to join us next week for a non-call-in version of Ask the Specialist. This will be Ask the College Specialist. I'm Amy Robinson. Good night.